Hi there, my name is Jennifer Grizzle. I am a women's health nurse practitioner student at Emory University, and I'm going to talk to you a little bit today about what WHNP means and scope of practice, as well as some different settings that WHNPs can work in. So what is a WHNP? Women's health nurse practitioners are a type of advanced practice registered nurse that provide care to women throughout the lifespan. So this starts with pre-adolescent girls all the way to postmenopausal women. However, though you are a WHNP, the women's can be kind of misleading because there are also many situations in which you are providing care to men as well. So what all does a WHNP do? Well, women exams are a huge portion of what WHNPs do in health promotion and disease prevention. There, provide contraception and education on contraception, screen for, diagnose, and treat different STIs, prenatal and postpartum care, preconception counseling. You do sexual health screenings, and again, that can be male and female, pap smears and pelvic exams, menopause education and treatment, as well as prescribing and managing hormones. And that's not just limited to the menopausal women. It also includes transgender populations that are interested in transitioning. Treat feminine-related diseases such as ovarian cysts, breast concerns, and urogenital concerns. And women's health nurse practitioners can also do in-office procedures such as IUD insertions, confirmation of pregnancy ultrasounds, and colposcopies. That requires a little bit of additional checkoff, but there's some clinical aspects to WHNPs as well. Where all do WHNPs work? So they can work at a variety of different settings. Private OBGYN offices are probably one of the main places, but there's also a lot of work to be done at women's clinics. You can work alongside GYNs that are specialized in different areas, such as infertility or GYN oncologists. And then there's some other really unique opportunities at women's correctional facilities or working in forensics. And again, forensics would definitely include male and female patients. So why did I choose women's health? So women make up half of our population. However, women's health issues are just super overlooked and still highly stigmatized. It's still something that I feel our society has a lot of shame in discussing. And there's a lot of issues within our current state. Georgia actually currently ranks highest for maternal mortality. And I just think that's unacceptable, and I want to fight to work on that number and provide all women free, access to care as much as possible. So I've also worked as an operating room nurse the last few years, and one story that really touched me was I had a patient come in who had struggled with abnormal uterine bleeding her entire life. It was kind of like every day she woke up as though she was on day 2 of her cycle, and before we took her back for a hysterectomy, that's ultimately the decision she chose in order to manage this because she had tried other treatments and nothing was working. She was so excited to have her hysterectomy done, and she started crying before we rolled back, and she told me that the first thing she was going to do after she recovered was buy a pair of white pants because she had never been able to do that before. So that's just one of those little things of quality of life. Women taking control of their health is empowerment. It's taking control of things that are bothering you, being able to talk about those concerns. I think that that's really important. And again, I want them to be brought to light, this different issues, so that they can help and that women can get treatment whenever they need it. Here are my references. Thanks so much for listening. I hope this provided a little bit of information on what a WHNP does and how they work in a variety of settings and the different things that WHNPs provide.